An automatic external defibrillator, or AED, is a portable device used on an unresponsive or collapsed person. It delivers a shock to the person's chest intended to restart the heart's normal rhythm. Using an AED with early CPR improves the probability of survival during cardiac events. You can find AEDs in many public spaces these days, so if you find yourself in an emergency situation, an AED should not be too hard to find. A provider should only apply an AED to a person if they are unresponsive, not breathing or breathing ineffectively, does not have a carotid pulse, or the provider is unsure of a pulse. Remember to clear the scene for safety before approaching the person. If they are not breathing normally with a weak or absent pulse, send someone to activate emergency response and retrieve the AED and begin CPR. For adults and teens, provide cycles of high-quality 30 chest compressions, followed by 2 rescue breaths delivered over 5 to 6 seconds, watching for the chest to rise. When the AED arrives, continue providing CPR as the second person turns it on and prepares the kit for use. Remember to quickly examine and prepare the person before placing the pads to maximize the efficiency of the AED, minimizing interruptions to CPR as much as possible. Expose the person's chest. Remove or cut away clothing and undergarments. Remove any medication patches and wipe the skin clear of adhesives. Check for a pacemaker. A pacemaker will make a visible bulge under the patient's left clavicle. Do not place pads directly over this area. Place pads on the high right and low left, avoiding the pacemaker. If the person has excessive hair, the electrodes will not make sufficient contact. If a razor is not available, you can press the AED pads firmly down on the contact area and remove them quickly to pull the hair from the chest. Replace them with a fresh set of pads. Ensure the person is dry. Water can interfere with the shock by making the pads less sticky and compromises the electrical conduct. AED kits come with adult and pediatric pads or insertable keys to differentiate the level of shock delivered to infants and small children from adults. Each will have a diagram included for proper placement. Place the pads on the person. For adults and children 8 years and over, use the adult pads. Place one on the upper right side of the chest above the breast and the other a few inches below the left armpit. For infants and children under 55 pounds, place one pediatric pad centered on the chest and one pad centered on the back. Continue CPR until prompted and allow the AED to analyze the heart rhythm. This should take up to 15 seconds, and continue following the voice prompts. If the AED prompts you to check electrodes, check for contact. Remove any obstructions, press the pads firmly down, or replace them if needed. If the AED prompts that no shock is advised, resume chest compressions. If the AED prompts that a shock is needed, remove oxygen and make sure that no one is touching the victim. To deliver the shock, press and hold the shock button. Resume chest compressions after the shock. Continue following the prompts from the AED, continuing the cycles until the person becomes responsive or the EMS have arrived.
If you enjoyed this video and would like to learn more, check out our Medical ProCerts video library on YouTube, or if you would like to certify in ACLS, BLS, PALS, or CPR, simply register and certify online today at www.medicalprocerts.com.